So thank you for joining us today. My name is Sam Fletcher. I'm the Executive Director of the New York State chapter of NASW. This is our first chapter chat that we've had since June. So I appreciate everyone joining us for this very important topic. And I know a lot of clinicians are really wondering about this right now and wondering what to do with COVID and opening your offices. So I feel like this is a very timely time to have this chapter chat. After working with Callie on this, we figured that we probably need to split this into two because there's so much content. So today is the first part, and we are recording it so we can send it out to people. And then part two of this will be next week on September 3rd at 12 noon. And then I just wanted to let you know about two upcoming chapter chats as well. On September 9th at 6 o'clock, we're having a chapter chat focused on voting because, as we all know, this is an extremely important time for people to have the opportunity to vote and to be able to vote and have their vote count. And we're having an additional, I just have to check my notes here, we're having an additional chapter chat at the end of the month on September 24th at 6 o'clock. And this is going to be for students. Why should you join as a student? So those are our upcoming chapter chats. And now I'm going to hand this over to Amelia, who will tell you how to interact with this chapter chat with us today.
Hi, everyone. My name is Amelia. So today, I think everyone here may have had some experience using Zoom now that we're living in this COVID world, something we'll probably talk about on this chapter chat today. So there's going to be opportunities for us to engage, ask questions, discuss throughout the presentation. We ask that you keep yourself muted when you're not talking, just to not have any of that background noise. Callie will identify points during the presentation in which we will start discussing, or we're open for a conversation or question, and then we'll have you unmute yourselves and talk then. You can also chat or ask questions to us about other NASW related things or technical help or issues through the chat function to Sam and I. So we really look forward to this presentation today. Thank you so much, Callie. And thank you everyone for attending, and I'm just gonna hand it right over to her.
Very good. Thank you, Amelia, and thank you, Sam, for inviting me and asking me to pull this information together, because in this world that has become so upside down, we don't know where we stand anymore. Whether it be as clinicians, as social workers, and especially as private practitioners, because we're really out there. We were already out there flying solo to begin with. Now this just really brings another layer of information and confusion that we need to untangle for the safety and well-being for all of us, because it's not just about the patient, it's about ourselves as healthcare providers, the patient, and for public safety. So that was one of the things that I, when starting to pull this together, realized how enormous this really is and the importance of breaking it down. So even though there may be 2 sessions on this, it doesn't mean in the future that as we move through this, that there won't be additional questions and information, and the information is constantly changing. So as the government is learning more and more, and the medical profession is learning more and more about this virus and how it works and how it lives and breathes. So with that said, so I wanted to welcome everybody. We're going to focus today on some opening protocols as recommended by the CDC and other governing bodies. This has been implemented a little bit from my experience. I'm not seeing a lot of clients in the office. I think maybe 2 at this point, very short term. So it was a very interesting experience to be able to pull this information together and actually implement it. Brief overview. I'm sure we all have an understanding as to what COVID is. I'm going to take a few minutes and just briefly touch on it, just to raise the awareness. The meat and potatoes of the presentation is going to be about reopening and the things to think about. I've broken this down into 5 sections. These last 2 sections, the reporting and the legal. Again, I'm not a medical professional or a legal professional, but whatever information I'll be able to find, I'll put it in an organized fashion and put it out to the community, to the professional community. So our focus today is just a summary of what it is, what to look for in efforts to have the best safe opening possible. And then we'll have a bit of discussion. So there'll be 2 sections shortly before part 2 and toward the end to be able to have any sort of discussion at that point, because there is a lot of information for us to get through. Okay. Again, just to reiterate, this is a summary of information pulled from the government websites. This is not replacing legal or medical advice. This is just a conglomerate, a summary of information that I've come across. It doesn't create any sort of legal relationship, and I would highly encourage you, because it is constantly changing, that you do speak to medical and legal professionals as situations arise, because they are very individualized. Okay, so let's jump into this. What is the virus? The COVID-19 is also known as the coronavirus, is known as SARS-CoV-2. We've noticed that a lot of people who are the older adults and have underlying medical conditions are the ones most at risk. At least we started thinking that in the beginning. Now things are developing more and more. The studies that are being shown that it's becoming more airborne is what the understanding is. It's spread mainly from close contact from person to person. Some people are symptomatic, some people are not. That's what makes this thing so volatile. The main form of spreading is from person to person. CDC recommends 6 feet. We've noticed that every place we go, everything is labeled off by 6 feet, and it's passed through respiratory droplets produced when an infected person sneezes, coughs, or talks, hence all the masks that we wear. These droplets can land in the mouths or noses of people who are nearby or possibly inhaled into the lungs. It spreads very easily through people. There was some concern through animals. Originally, it was stated that children were not carriers to be able to pass it on, and as we've seen in time, that's changed, especially with the concern of reopening of schools. The virus can spread many other ways, whether it be touching on the surface. There was concern with food delivery and such. Again, information has changed over the course of time, so that's why it's important that we do tackle the government websites and stay on top of it as much as possible. Which is a quick side note, they do have newsletters that you can enroll in with your email address in efforts to get information as it changes. How do we protect ourselves? Best part is not to be exposed to the virus. I know a lot of us are doing telehealth from home. That is the CDC recommendation form of service to produce the service. There's no vaccine, even though that's being worked on. It's spread from person to person. Again, the importance of 6 feet. And we don't know. We don't know who has symptoms and who doesn't have symptoms. And that's the confusing part. I found this video, which was very interesting in explaining. If you go onto YouTube and you put in animation of COVID virus, you'll be able to find some videos of how the actual virus spreads. And I took a screenshot of this because I found it pretty powerful as to a sneeze, a regular sneeze, how it transfers immediately in 3 feet. It takes 5 seconds for those particles, those microparticles, to travel 6 feet, 10 seconds to travel 9, and they linger 30 to 40 seconds, up until 12 feet. The reason one of the things that struck me with this is we don't know who sneezed into the air, and there are people that don't wear masks and stuff like that, which is a whole other topic within itself. But if someone sneezes that doesn't wear a mask and they walk away, and 12 seconds later we happen to walk by, we run the risk of possibly containing the virus or obtaining it. So this was pretty interesting when I saw this as to how powerful this virus really is, and something to think about when we open up our offices in time, the importance of the distance and following whatever strict protocol that we come up with according to the regulations. Hand washing, we hear it consistently. Make sure we wash our hands at least for 20 seconds. Sing happy birthday or the ABCs. There's a big push for the alcohol to be 60% or more. One quick thing with alcohol, it's important to look at the labels. Like with anything else, there's been some stories that have come out and verified that there are some hand sanitizers that either don't sanitize, they don't have the correct ingredients in them, and some of the ethyl alcohol has been replaced with wood alcohol. I think it's called methyl alcohol, if I'm not mistaken. And the methyl alcohol or the wood alcohol causes nervous system damage. So you want to make sure that you look at the label and make sure that it says ethyl alcohol on it, okay? And if you don't recognize what the ingredient is, Google it and see what's on there, what Google has to say. We want to avoid close contact. If we're in our home, again, the 6 feet rule applies. If we're outside of our home, distance people as far away as you can. Okay? Keeping distance is very important. That's really the saving grace. Important again, we're all wearing masks, social distancing. I know this is a little repetitive. Masks, the CDC recommends that anybody who's under the age of 2 or anybody that has trouble breathing or unconscious, that they don't have to wear the mask, or anybody that can't remove the mask on their own. I was in a store one time, and there was an exchange between two customers where one person was wearing like their shirt lifted over their nose, and the person behind them got really upset, and the two of them got into a heated exchange. The woman decided to stop her confronting of this individual, and this person turned around and said to me, "I can't wear a mask," and pulled his shirt off, and he was all allergic. His whole eyeballs were blown up and had all scars underneath. So we have to be sensitive. As much as we have to be safe, there's a degree of sensitivity and problem solving, because every situation is going to be different in efforts to promote that safety. Okay. One piece on this slide, the mask is not a substitute for social distancing. In my travels, I've heard people say, well, as long as we're far apart, I don't have to wear a mask. This goes back to that slide as to when there's a sneeze, how far the microparticles travel and the degree of risk that's involved. Okay. Again, always cover our nose and mouth, use tissues, throw in the trash, and wash our hands. Now we're getting into cleaning and disinfecting. We have to wash everything down, frequently touch surfaces. Some of the locations, tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and anything else that you could possibly think of that would make sense about a high frequently touched area. If the surfaces are dirty, you want to clean them first with soap and water before we disinfect them, because the disinfecting, if it's something that's got a lot of dirt to it, it's only going to create a mess. And we'll get into this in a little bit, but the EPA has a list of household disinfectants that are registered and approved according to the Environmental Protection Association. So we'll get into that in a little bit. Important that we're aware of our symptoms. Okay, what are the symptoms? It's important that we take care of ourselves and we become aware of that. We want to be able to take our temperature. There's a lot of thermometers on sale, especially the touchless ones. It's important that you do get one for the office. They run anywhere between $60 and $80, depending on where you get it from. You want to take your temperature, yours and the patient's. And it's recommended that you don't take your temperature 30 minutes from exercising or after taking medication, because it can fluctuate your temperature. Again, all this information is on the CDC website. Here's an image from the CDC and a list of how to manage symptoms at home. So we want to stay home, monitor, get rest and stay hydrated, very important. We want to call our healthcare provider ahead of time, check in with them. If for some reason we need to call 911, God forbid, whether for ourselves or for a patient, you want to notify the dispatcher. Important, any sort of cough and sneezing, that we do cover, that we do cover our nose and our mouth. We wash hands often and stay away from other people. Avoid sharing personal items and clean all surfaces. I know I just breezed very quickly through that, but I think it's information that we kind of already know, but to raise the awareness as we transition into part 2. So with that said, what's everybody's thoughts and concerns regarding, where is everybody at regarding opening the office? This way, as I go through the next part, maybe hopefully I'll be able to address some of your concerns.
So right now would be a time if you would like to discuss or talk about some of your concerns or your anxieties or what you've been thinking about. If you'd like to unmute yourself, we can have that discussion and hear you. And also I see that there's some people that are writing in. So Katie said that they have started seeing 4 people, 2 a day in the office. And if there's any, concerns or things that you guys want to cover upcoming, do let us know.
I don't know, can you hear me, Amelia? It's Lael.
Yes.
Oh, good. So, Callie, my big concern regarding in-person, sessions is all of those things, like all of the surfaces, how many feet apart. Because in one of my offices, I can do more than 6 feet, but in the other one, it's barely 6 feet from seat to seat, diagonally across. I don't even know. I'll have to tape measure it. And then, of course, wearing masks, I guess, would be something that would have to be used throughout the session. So those are like my primary concerns about starting to see people in person again. And also the other issue that raises along with that are the liability issues connected to all of that.
Okay, great. Okay, but we're going to touch on some of that.
I also have Christine wrote in. Christine said, what if they have a sofa that can't be wiped down? Susan said, I haven't started seeing people in person. What about air purifiers? What's needed?
Okay.
I have a concern. Can you hear me?
Yes, we can.
It's Patty. Okay. One of my concerns is reporting. Do we have to report to state or CDC and like HIPAA compliance? I worry about that.
Hi, Patty. Nice to meet you. In regards to reporting, I'm going to be looking into that because I haven't been able to get a definitive answer with references. So I'm hoping by our next meeting next week to have a little bit more of a direction and resources. The fast answer that I have for that is I would reach out to your malpractice insurance and speak to their legal department. I've recently discovered that NASW National has a legal and ethical hotline that is a benefit for members. So it was an excellent resource for me, I found. It's on the website. I'll include it at some point next week. I'll send that information out. So it gets very specific when it comes to the legality, which is out of my realm. But what I'm looking to do is find the resources to pass them out. And then we can always check with, specific legal and specific ethics and such within our parameters and the coverage. The malpractice insurance would really be the place to go. I would check with. So that's a quick answer. So
Thank you.
I have a question, Teresa. I've been doing the telehealth with clients that I've already had. I will be meeting with a new person next week in my office. Maybe this is for a next session, but does anybody know how long this telehealth is going to be allowed, I guess, as far as billing insurance companies? What I thought, maybe just meet with the people once or twice, new people to connect, and then if they're okay with it, just do the telehealth, by telephone. I'm not set up for any video or anything like that. So again, I guess, are we allowed to do telehealth forever for now? Or are they going to say, nope, we're not paying for that anymore. You have to go one-on-one. That's what I've always wondered about.
okay, I can touch on that. That's not a problem.
Okay.
Very good. Thank you. Okay, I guess we'll start moving forward. And at the end, if anybody thinks of anything, please feel free to put it in the chat or ask at the end, or we also have next week as well. Okay, so break concerns. Okay, some things and reflections. And again, I pulled this together based on my experiences and my feelings regarding seeing clients back in the office. I know when this thing first hit, we all jumped into, the telehealth and the phone, and, the federal government made some adjustments and such to be able to service our clients. The idea of meeting somebody back in the office, really, I know I had to do some soul searching and efforts to figure out what was my reaction to it, because I didn't want any of that to get carried out in the face-to-face session, because as clinicians, obviously, we're there for the client, but we have to take care of ourselves as well. So some things that we have to think about is, what's the motive behind returning back to the office? Is it financial? And these are things that I've heard from March, when all this started kicking in. And these are all different things that I've been noticing on the listservs that I belong to. Is there a financial pressure? Pressure from clients that don't want to do the televideo? When are you going to see me back in the office? Our own personal feelings. How do we feel about all this? The fear of going back into the office. If we're employed with an agency or have an employer, are they mandating us to go back into the office? And at what point, when that happens, how do we feel about that, and how do we work with that? And then at some point, it's going to be time. As this thing becomes more accustomed and more of a way of life, there's going to come a time where, okay, we're going to have to get back into our offices. Some office considerations. Okay, we need to self-evaluate and calculate degree of risk. And you're going to hear me say this a handful of times, which ties into the liability piece. There's a big mind shift I realized in going through this and pulling this presentation together, that we're not just thinking as psychotherapists anymore. We're thinking as business owners. We're thinking as medical, which is big, because previously we didn't have to deal with infection control and such. So now we have to think like a medical professional in addition to behavioral health. The CDC recommends that the primary vehicle of service is telehealth. In regards to the insurance companies and how long this is going to take place, the best answer I can give with that is, one, it's going to consistently change. But my understanding is, as long as the executive order, there's two main orders that are in place. As long as the governor's executive order is in place that states we remain in a state of emergency, hence the pandemic, then the Department of Financial Services order that states the guidelines that the DFS is putting out, as long as the state of emergency is in place, their executive order is in place. So the two go hand in hand. One is based off of the other. The DFS executive order, I would have to look at it more specifically, but my understanding is that anybody that's regulated under the Department of Financial Services will need to follow the guidelines, hence pointing back to the executive order for New York State. Okay? So again, one is linked to the other. The pattern that I've noticed with the insurance companies is they set a date. It looks like anywhere between every 60 to 90 days, because of all the cost sharing and the coverage that they need to do and whatever else is going on behind the scenes for them. They're setting the dates, and we see as we go. I'll label it as such. But at the end of the day, they have to follow the Department of Financial Services executive order. Then there's a lot of specifics regarding payments and what's covered and essential workers. And recently there was a bunch of emails that I started getting from the insurance companies that people must have been charging for masks and such if people were coming to the office and didn't have masks. There were a bunch of emails that came out that made it very clear that providers are not to charge patients for PPE supplies, masks, gloves, sanitizing, et cetera, et cetera. Like, we have to provide those items if someone comes in without a mask, which I'll get into.
Well, can I just ask you something, please? We have to provide those things. We can't ask our patients to provide them. I know we can't charge them, but
yes, they can bring them. They can bring them, absolutely. But if someone walks in without a mask, we can't say to them it's $5 for a mask.
Gotcha. Okay.
Yeah. no, absolutely. They can bring their own mask. And I have found with the handful of people that have come into the office, when I've said to them, please be sure that that you're wearing a mask, that for the most part they do. I'll get into some of my experiences in a moment, but for the most part, I find that they do, especially if you preface it. And we'll touch on that in a few minutes. We want to be aware of the ethics, legal, licensure, and the insurance company regulations. Not all clinical concerns are appropriate for telehealth. Some instances need to have face-to-face, and this is what does one do? As much as we're doing all telehealth, and this is what the CDC recommends, I know I've come across certain instances where a person may get triggered from something that we're talking about, and there's just something to be said about being in the office face-to-face to help ground them. So that's how I've chosen to utilize my office, where the bulk of my work is telehealth, but on an as-needed basis, I have the freedom to see the patient in the office and still have my protocol set up according to the CDC and what the regulations are, so I can be in compliance to hopefully reduce the degree of risk from health, liability, privacy, and all the entities that go together that we need to follow. It gets complicated, it's like a labyrinth, but these are all the things that we need to follow, that we've always had to follow and did follow, but now it's brought to the forefront because of the severity of COVID and what it is that we need to deal with. If that makes sense, I hope that I explained that okay. Okay. So the first part we're going to tackle is we're going to evaluate our office, some patient considerations, and disinfecting procedure and tracking. Again, this is general information. Each and every one of us has to come up with our own procedures for the office. So my role is to offer that information, not tell you specifically use this form or use this protocol, etc. Reporting and legal ethics and such, I'll try and have more information next week regarding this area. Okay. So the first part is objects of transmission. Okay. We have to look for high frequency touch points. Go through the office and remove any shared items, anything that has the potential for transmission. Any toys, any magazines, candy dishes, business card holders, anything and everything. We have to be creative. You'd be surprised how many things are considered high touch points as we go through and scrutinize our offices. Make a list of these items and remove them. When in doubt, this is the rule that I go by. When in doubt, leave it out. You can always add it in later after you calculate the degree of risk. You want to review all areas: offices, hallways, bathrooms, front desk area, file rooms, kitchens, waiting rooms, not just client areas, but all areas. Everybody's offices are in different environments. You want to look, if you're in a building, have a conversation with the landlord or with maintenance to get an understanding as to what are they doing, so that you can incorporate that information into your safety protocol and have it documented. Okay.
Callie, I have two questions, if you don't mind me throwing them as you go. I don't know if you're planning on already, answering them. One question we have is from Maria. Do they have to report their plan and to whom? And one question is from Christine, whether or not you can refuse to see a client if they are not wearing PPE.
Okay. The refusal, I know I've read about it, but I'm not prepared to touch on it. That's going to be a little bit more next week. The planning and the reporting, that's more of a legal question. I would ask the malpractice people. I'm a little bit more meticulous and a little bit more neurotic when it comes to this stuff. So I'm a big believer, have it prepared. May we never have to use it, but if something comes up, we have it ready. That's my school of thought. In regards to reporting, I don't know, I haven't seen anything about reporting actual protocols and stuff, but again, that's a question for legal. I would think if something comes up, then at least we have it outlined.
Callie, it's Sam. So we actually opened up our office this week because we have some interns who came in to work. And I did have to submit to the state. Like I had to submit my plan and write everything out. And I had to sign a thing with the state saying that I had a plan and this is what the plan is. So I went on the COVID I actually went on the governor's website where it says COVID at the top, and I clicked through, and it has you go through what type of business you are, and then it tells you what you need to do. So I would suggest people go to the governor's website and put in like that they're, you know, a private practice clinician, or like it has different topics that you can look. So I did like nonprofit for our office, but yes, they had like a 7-page document I had to complete with the plan and everything. So I just wanted to let you know about that.
Great, thank you. Thank you, great information. I didn't know that, so that's great. Okay, so to continue, great questions, thank you. We want to evaluate any treatment equipment, any play therapy, any toys, any tables, art therapy, anybody who's trained in EMDR, any tappers, eye movements, the eye movement boards. You want to take a look at all that. Trash cans, storage cabinets, any handles, coat closets, coat hooks. Consider disposable supplies wherever possible. And the trash cans to either have the sensor where the lid pops open or the foot pedal so someone can step on it, so everything becomes touchless or contactless, I should say. Okay. The second part with office evaluation is structural changes. You want to look for ways to reduce transmission. Evaluate the waiting room. Is it large enough? Are there other clinicians in the office suite? If there are other clinicians, I would encourage everybody to sit together and have a meeting regarding coming up with a plan for the office suite, regarding scheduling. We're going to get into this in a moment, but there's something, patient triage. How are we going to do traffic management with patients? Okay. If the waiting room is a common waiting room, how is that going to be handled? Okay. In some instances, the layout of the office needs to be rearranged. And again, eliminate any items of transmission, secure items to control of usage. Something as simple as a clipboard. You know, many of us don't have administrative assistants, so we would leave the clipboard with the paperwork in the waiting room. You know, we have to think about, is that something that we want to continue doing? What's the degree of risk of doing that? Again, these are all questions for legal and malpractice to ask to get clarification specific to your setting and to your office. In this electronic world, there are lots of resources regarding how to turn our paperwork into an electronic form. That's a whole other presentation and discussion, but that's something to think about as well. Okay. 6 feet minimum guidelines. Question for legal, if there's not enough.
Can you go back to that last?
Sure.
Yeah, I want to copy the rest of that.
Sure. What's going to happen is if you don't have anything written down, I'm going to pull together a resource book that's going to have all the links where you can find this information.
Oh, okay, thank you.
Okay, so just, I try not to, don't worry about writing everything down because it's a lot to write down.
Okay.
If there's something specific, feel free to throw it on the listserv. I'll be more than happy to answer it according to the information that I have. But after the second session, my plan is to get that resource book with all the links out to everybody. So
Thank you so much.
you got it. I'm not sure what if the 6 feet minimum guidelines, if our offices are small and we can't meet that, I don't know what that means. So I would reach out to legal. I don't know, the health department, maybe ask a medical doctor. Some offices, depending how big, if it's a bigger practice, are offering hand sanitizer stations. I know I have a bottle specifically for patients when they come in. I say to them, please sanitize your hands. I have it on the table. We've noticed around in a lot of stores and in our travels, a lot of places have sneeze guards. There's a lot of stores that are selling the sneeze guards, anywhere from Staples to Office Depot to Home Depot, Lowe's, Amazon. Prices I've noticed run anywhere from $100 to $300-400, depending on the size. If anybody is handy, or has a family member that's handy, you can go to YouTube. There's a ton of YouTube videos that talk about how one can make a sneeze guard. So lots of information on that, which is pretty much a piece of plexiglass on legs. Some of them have openings, so if anything has to get passed through the hole, like a piece of paper, a pen, whatever the case may be. But the idea is to put a barrier between the clinician and the patient. We want to evaluate our bathroom. Is the bathroom in the suite or is it public? Are we going to allow people to continue using the bathroom, or we're going to put it off limit in efforts to reduce the degree of risk? Again, these are all decisions that are individualized and varied from office to office and clinician to clinician. Ventilation. Does the office have windows? If you go to YouTube and you put in the aerolization of COVID virus, which will give you the video links to that one screen that I had showed you. It talks about that if the window is open, it has the opportunity, I guess the pressure or the way that the air circulates, there's a higher likelihood that the virus and any particles will go out the window. So ventilation is important. I'm not sure if the state or the federal government is requiring landlords to change their ventilation system. So that's something that you would have to ask your landlord regarding if the windows don't open. Someone had asked about air purifiers. That's something I have to look into. I know there's different types of air purifiers. Just have to do some research. I can't necessarily make a recommendation as to which one is better than the others, but I think every little bit helps. Also, in addition to ventilation, which I'm going to jump a moment, in some of the other listservs I belong to, people were researching UV lights, which I'll get to when we get to that slide. So again, a lot to think about, and it could be very overwhelming. But if broken down into pieces, it can become very manageable. If we're working in an office that we have multiple staff, whether it be other suite mates or if we have our own employees, we have to take a look at work schedules, the same way that we look at patient schedules. Look for ways to reduce staff load in the office. Stagger staff in the office. Have some people work from home and others working in the office in efforts to reduce the degree of risk and people cross-contaminating and being able to maintain the minimum 6 feet distance for safety. Okay. UV lights and air purifiers. I'll try and get more information for next week. I would say just do a Google search. They have portable machines, big machines. They have light bulbs for lamps, but we have to learn more about them in efforts to learn how to use them safely. My understanding from the research that I have done, the little research I have done about them, we can't be in the room. In some instances, it can kill certain plants, if I remember correctly. So it's a whole other topic, UV lights and air purifiers. But I would encourage everybody to Google, and maybe next week we can exchange ideas and see what we come up with. Okay, protocol. Method of service delivery. As I said, the CDC recommends telehealth as the first choice. We need to evaluate medical necessity for face-to-face visits. We need to have an understanding of our patient's medical history and evaluate who's high risk. That if someone has a medical history, we have to ask ourselves, is this person, even if a person is telling us, look, I want to come in, etc., if they have severe medical issues, we have to make that determination what the degree of risk is if we want to see them in the office or not. And again, it's very individualized, and we have to consult with legal as well. Evaluate traffic patterns. Where's the client going to wait for appointments? A lot of the medical profession has a lot of us waiting for in our cars, and we call the office and let them know that we're present. How will our clients notify us? By text, by email, by phone. If we're using text or email, as much as the federal government has alleviated some of the restrictions with HIPAA compliancy, we still have to be mindful of it. Okay. How long will each patient appointment be? We have to now leave time. The days of back-to-back have lightened up now. So we have to leave time to be able to disinfect high-touch areas in our office. Desks, chairs, And there's a slide regarding some disinfecting regarding porous materials and such. But light switches, doorknobs, we have to be mindful of all that and to be able to go around and give it a wiping. One of the things that the CDC is recommending also is to put signs around the office to wear our masks, what the symptoms are, what our office protocols are, how are we handling this? We have to educate our clients. Okay. So one thing that seeing my handful of people, the protocol that I've set up is I have the client sit in the car. My texting and email is not HIPAA compliant, so I've made it very clear that they need to leave me a message and wait for directions. At that point, I will meet them at the door and bring them into my office. Sometimes people would bring friends and family members to the sessions. Those individuals, I don't allow them to sit in my waiting room. They have to stay out of the office. I have what's called what I've labeled as my COVID bag. It's a suitcase on wheels, and I have all my supplies in there. So I not only have my briefcase, my handbag, I now have my COVID bag and anything else that I bring with me to the office. Okay. Patient questionnaire. I came up with mine by doing a lot of Googling and seeing what the questions that were being asked are, and I just created my own. The questions that are often asked are related to symptoms, travel, temperature, PPE, are they wearing them? Did they come on their own? Did I supply them? I invested in the touchless thermometer. I take the temperature and I document it on the questionnaire. I have the client sign the questionnaire. I have on here file in the chart. I don't know if it has to go anyplace else, but that's just what I'm doing with them for now until I find a different answer. And you want to have the PPE supplies available on the chance that someone comes in, they forget their mask, it's broke. They may have a reaction to wearing mask, and after a conversation with you, they may decide like, okay, if I'm going to see my therapist, I have to wear it. So you have one on hand. Tissues and hand sanitizer. Again, we've become a walking medical supply store with all this. Okay. And one of the things you can Google is patient health questionnaire COVID-19. And there's a lot of samples that have come up. Okay, I'm going to jump through this because I kind of covered on this. Okay, how's everybody doing with this? Am I making everybody's head spin?
Possible, right?
Pretty straightforward, but it's a lot to absorb. Okay. So the second part that the CDC recommends is that we educate our patients, which they're members of society. So it's not only to help keep them safe and ourselves, but it becomes a public safety service as well as healthcare providers. So the CDC is recommending that we post signs in our office, educate and have an education discussion. One of the things I haven't gotten a chance to do yet, but if anybody has a website, you can also put the information on the website. You just have to check with the CDC what they allow to put the permissions as to how you can use their information, but you can put some stuff on a website as well. Just be sure you reference it. How you distribute the information on a pamphlet, website, internet resources. Again, we want to educate our patients for safety and well-being. One of the things that's important that I know I came across is to assess our own belief system and where we're at with all this and where our patient's belief system is. You're going to come across things that are going to surprise you. Your patients, as much as we kind of know them, when it comes to something as heated with their belief systems regarding masks and safety, and they'll come in with the mask and take it off during session. They'll come in and instead of having it completely covered, they'll have it here or they'll move it here. Some people believe in it, some people don't. So it's important to have these conversations and efforts to establish what your protocol is to keep them safe, yourself safe, our families, and the public. Okay? And part of that discussion is to assess, is everybody making good choices to stay safe and healthy, locally and globally? Okay. Informed consent. I'm sure a lot of us have put together an informed consent for telehealth. Again, if you Google around, you'll find lots of samples, but you always want to get your copy reviewed and given the stamp of approval by legal. Okay. Some things with the telehealth, you want to assess for appropriateness. Where is the patient located? Are they in a confidential place? I've had clients kind of sneak in and they're driving home and they're in parks and school parking lots and the signal's weak. It becomes quite the challenge, the telehealth, but all stuff that you work through. And as you gain the experience, you set the limits and boundaries regarding what's acceptable for everybody's safety and a low degree of risk. Okay? You always want to find out with informed consent, an emergency contact and what happens if technology fails. How do you get a hold of the patient again? And where is the patient? Because sometimes they rotate locations where they're at according to where they need to find privacy on their end. So it's a lot to think about, but all things that we've started to transition into. Now with COVID, there's an informed consent. So now we're up to 3 informed consents. The first one is for psychotherapy. The second one is for telehealth. The third is now for COVID and any other consents with any specialties that we might have. So the COVID consent, from what I see, the patient consents to awareness that the risk is contagious and it could spread. Sorry, not spread, but spread. It raises the awareness to the patient, the degree of risk. It authorizes the release of information to the health department and governing bodies for contact tracing as required by law. I don't know the specifics of that, but in some of the consents that I've looked at, there is a statement on there that says that they're giving you permission to report it. Okay. Beyond that, that's a legal question. And for the malpractice people, for the health department, so we need to get more clarification on that, which I hope to have more information next week. Patient agrees to follow the safety protocol. That's why it's important to have the protocol written out so we can educate the patient, and they have to agree to it. They have to agree to notify the therapist of any symptoms or any positivity, whether themselves or any family member or people that they've been around before appointment. They need to consent that they're aware of the above and the opportunity to ask questions with answers to their satisfaction has been given it to them. On the NASW website, there is a template that was distributed regarding a sample of informed consent. You could also Google, but again, I know you keep hearing me say this, very important, you have to clear it with your attorney, okay? In one of the conversations I had with an attorney, I had asked them about liability and can a patient sue us if they were to test positive in our office? And the response that I got was, although it was difficult to prove, the patient can sue the clinician if they believe that they tested positive because of us. Again, this is why we have to cover ourselves with consents, with protocols, with our COVID bag, with everything that we need to do. So it's degree of risk that we can reduce the degree of risk as much as possible.
Excuse me, Callie.
Yes.
You keep talking about having our attorney. I don't have a retainer for an attorney. Can we use NASW or our insurance companies, or malpractice insurance companies?
If it was me, I would start with the malpractice.
Okay.
Insurance companies, I don't know if they're going to tell us. You can try, but I don't think that they're.
I'm sorry, I meant the malpractice companies. Yeah.
I would start with the malpractice, and if they can't, I can't imagine they can't answer, but they'll direct you. They'll tell
Okay.
you where to go.
Thank you.
Okay, you're welcome. Okay. Just some more information, components of the patient questionnaire. Okay. Give me a chance to look at that. Office protocol, an outline that I came across. So we're looking at triage. We assess for medical necessity. Office expectations, okay, masks, refusal, all these things we have to think about, mandated reporting. We have to evaluate for object transmission, containment, disinfection protocol, supplies, patient forms and referrals, what does our paperwork look like, and how are we gonna utilize it now, and education and resources. Okay. Okay, so now the fun part. Okay, there's about 10 minutes that I have to get through this, so I'm gonna breeze through this. If I skip over anything, I can always review it a little bit more next week. I can have a brief overview, but again, the links are gonna be offered in this resource manual that I'm gonna be putting together for everybody. If you go to the cdc.gov and just put in disinfecting, you'll get a ton of links as well. Anything related to disinfecting and resources in the EPA and products, et cetera, et cetera. Okay. You want to develop a plan? What needs to be cleaned? Create a checklist. Okay. How are you going to disinfect them? Is it soap and water? Is it hand sanitizer? Is it bleach? Equipment? What equipment are we going to do? I would make a laundry list of everything that we're looking to disinfect. Implement the plan. Clean the surfaces, use appropriate product, always follow the directions on the label. We don't want to end up mixing and matching anything and then run into a chemical issue. Create another list of what the supplies, all the PPE supplies, anything, office supplies, cleaning supplies, garbage bags. How do we discard this stuff? Which is pretty much at this point, I don't see anything that we're getting into like biohazard bags and such. I throw it all in a plastic bag, tie a knot in it, and throw it in the garbage at the end of my day. Okay, we want to continue disinfecting high traffic areas. Okay. Encourage hand washing, utilizing the PPE, social distancing. That's a theme across the board that I've seen. That's why I keep repeating it over and over again. With cleaning, you want to wear disposable gloves. Use soap and water first if the area in particular is dirtier. Then use the disinfectant. Clean with soap and water, reduces the germs and dirt. Practice routine cleaning and high-touch areas. Again, it's all about awareness and kind of walk through the office like a patient and really scrutinize it and see what you need to wipe down, what could be removed, what could be lifted, up on a shelf so people don't touch it. Okay. On the CDC's website, there's a link to the EPA, which is the Environmental Protection Association, I think it is. On their website, they have a list of all approved disinfectants. So that'll be in the resource book as well. And also you want to make sure that as we're using all these chemicals that we have good ventilation, and to be able to wear a mask as well, and to be mindful because we don't want to get hurt, breathing all this stuff as we're trying to protect ourselves and the public. Okay, this is some information. I'll give you a second to read through this. I'm not going to read through all this. It talks about bleach solutions. The one thing that I noticed in buying my own supplies is that the alcohol content, the ethyl alcohol in these gallon hand sanitizers, the percentage of alcohol varies. I happened to be in the store yesterday and I picked up these 2 gallons of hand sanitizer. One was 70%, one was 80%. And what prompted me to look at the label, I don't know, but looking at it, there was a distinct difference between the two. So you want to be mindful as to what the percentage is, to make sure that it fits within the CDC recommendations for disinfecting and et cetera. Okay. There was some questions regarding fabric furniture. This is the best I was able to find. Again, I'm sure there's more information out there. When it comes to soft porous surfaces, carpets, floors, rugs, drapes, couches, remove any visible contamination if we can see it with cleaners. Use the surface soap and water. If we can launder the items, great. Use the EPA household disinfectant. Just some ideas, because I was thinking about this. Some ideas, maybe put a cover over it, maybe like another slip cover or two. This way you can remove the slip cover and wash it. So I don't know. I don't know what the answer is for soft porous surfaces. We have to do a little bit more research. But again, it's using our best judgment and being creative. I think what it really comes down to. Or maybe we bring in a chair and the couch is off limits if we have to. Again, every situation is different. Every office is set up differently. Okay. Electronics, any computers and tablets, we want to wipe them down. Okay. Credit card machines.
Sally, I'm sorry to interrupt you again. When you're talking about wiping things down, do we wipe them down in between patients or do we wipe them down once a day?
From what I could see, it's in between patients.
Holy crap.
Yeah.
Okay.
Yeah. It's
I hope they continue telehealth forever.
it's
Can't do this.
when I said in the beginning, to be mindful of our own reactions. If the first couple times when you see somebody, we're going to be like heightened because we're so in tune to it, but don't be surprised if you have some reactions to it. And it's important that you're aware and respect those reactions, because it really is a different way of doing treatment, especially wearing the mask and getting used to wearing the mask all day and breathing, and you can't see the person's face, you can't see their facial reactions. There was my client yesterday, I was doing some EMDR on them because they were getting triggered from all this, and you read body language and facial expressions, and as I'm doing my tapping with them, I'm asking them, what is your facial expression? Because I don't want them to take off the mask. It was a very weird, surreal experience to have that, because you can't read the body language. I'm going to digress a minute. They do have face shields, like those masks that go over. Me personally, I don't know if I would trust taking the mask off. If there was an instance where we felt we had to, and again, I'm not saying you should or shouldn't, but I have seen and heard where people have either be maskless and have either a sneeze guard between themselves and the patient. I've seen other things and again, this is all information from various listservs that I'm on, where people have where they wear the face shields and take the mask off. Me personally, I'm not comfortable in rolling that type of dice unless it's an absolute extreme circumstance, and then that becomes a judgment call. Again, we have to make the best decision possible for ourselves. There's no cookie cutter process with this, because we know our clients and what we're willing to do and what we're willing not to do. So, okay, so this is some laundry information. Okay, this is the link for the EPA. That'll be in the resource manual. I don't know if this is needed, but once upon a time when I worked at a residential program, one of the requirements for that program was to have something what's called MDS sheets, which is the information sheet from the manufacturer as to what the contents are, and if someone does something with it they're not supposed to, whatever. I don't know if it's needed, but considering all this is all tied into infection control, I threw it in here. Maybe it'll be a good thing, maybe not. It's a question for legal, but I don't know. I threw it in there just for information more than anything. Again, for the sake of our health, we have to educate ourselves. Knowledge is power. Okay. And this talks about, this gets specific into HVAC systems and such, which I'm gonna jump over this. This talks about people getting sick. Again, if you go to the cdc.gov and put in disinfecting or disinfecting building, reopen guidance, some buzzwords, you'll get some information there. Sam had mentioned the governor's website. I haven't gotten there yet, but from what I glanced at it, it has a lot of information and guidelines for all businesses in New York State to follow. Okay. Again, this goes on a bigger picture: playgrounds, schools, parks. what requires cleaning, what's disinfecting.
Callie, it's Sam. I just want to give you a gentle reminder that we're at 1 o'clock.
Yeah, I figured as such. We covered the bulk of this. The only thing I'm just going to mention is make a supply list, have a disinfecting schedule, make a list of everything that you're going to disinfect, do a lot of reading, and pull together the best guideline you can and have it reviewed by an attorney. So you can see it's a lot of information, but I hope this was helpful.
Thank you.
Thanks, Callie.
You're welcome.
See you next week.
Take care.
Thank you all for coming and joining us for part 1. We did record this, so we'll have that available for people. And I want to thank Callie for coming back next week. And Callie, if I remember correctly, you're going to supply everyone with a resource guide next week, correct?
If it's not next week, it'll be shortly after, because I'm going to incorporate next week's information in the book. I'll do the best I can to have it next week, but if not, it'll be shortly after.
Thank you so much. I want to thank Marcia Levy for she was emailing me some resources. I put those links in the chat. Those will be with the recording. So our chat will be part of the recording. So thank you, Marcia, for doing that. I don't know if I got them all because I've been kind of running back and forth, but I just want to thank everyone again for joining us, and we'll see you next week. And if you have to miss it, don't worry, we'll record it and we'll send out the recording. So thank you all, and I hope you have a good day, especially as we're trying to figure all of this out. Thanks, Callie.
You got it.